All right, welcome everyone to Partners in Pain. My name is Kelly and I'll be your facilitator for today's session. Thanks for joining us, especially if it's snowy and blowy wherever you're coming to us from. Before we get started, I do want to start with a land acknowledgement. So as we gather today, it is important to acknowledge that we are all on treaty land. I'm joining you from Saskatoon and my office on campus, back working on campus again, which is in Treaty 6 territory and the homeland of the Métis. We pay our respects to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. We will once again start with a quick background as to what brought us here together today. So Partners in Pain grew out of the Improving Pain in Saskatchewan collaborative research project. The project aims to give pain a voice by bringing people together to share information and plan action to improve how pain is managed in our province. Already some amazing work that has come out of this research project, including our first pilot series of Partners in Pain webinars back in March 2021. The feedback from that pilot was positive and led the research team to seek additional funding, hopefully more funding in the future as well, to help support the continuation of the webinars. Partners in Pain received a Community Initiatives Fund community grant in mid-2021 for this additional series of webinars, which is what brings us here today. All of this work is supported by Sask Pain, a nonprofit organization, which is on a mission to help improve the lives of those living with pain in Saskatchewan. So before I introduce our first speaker, just our web etiquette reminders. So please keep yourself muted while Taisa is speaking today, just to minimize the background noise. Love to see all of your faces, so please keep your cameras on. I understand that sometimes the internet doesn't always agree with that. So if you're having some connection issues, it might help to turn your video off for the webinar. There will be an opportunity to ask questions during the session, so please submit your questions in the chat box, and I'll be sure to share them with Taisa. And we're hoping for we've left lots of extra time in this session today for some questions. So certainly feel free to post those sessions in the chat box. If you want to ask them privately, send them to myself, send them to Celine, and we will definitely share them with Taisa. Time to get started with our presentations today. So it is now my pleasure to introduce you to our first speaker for today, Taisa Trischuk. So Taisa is currently working as an academic detailer and information support pharmacist for RX Files Academic Detailing at the University of Saskatchewan. She completed her Bachelor of Science in Pharmacy degree in 2011 at the University of Saskatchewan, followed by her Doctor of Pharmacy degree in 2016 at the University of Alberta. Her pharmacy experience includes community pharmacy practice, medical oncology pharmacy at the Saskatoon Cancer Centre, and primary care at the Westside Community Clinic Pharmacy. Taisa currently provides academic detailing services to healthcare professionals in the Saskatoon area, as well as contributes to the development of RX Files educational resources. And I'm hoping she'll share some of those awesome resources with us today. And I have a fun fact for everyone today, and Taisa doesn't know I'm going to share this, but Taisa and I grew up together in Yorkton, and I actually used to babysit Taisa, everyone. So it is my pleasure to welcome Taisa to Partners in Pain today. And Taisa, I will pass things along to you.
Thanks, Kelly. Everyone can hear me okay? Yes, Kelly was by far the best babysitter. So I'm just going to take my time or take a moment here to share my screen. Okay. Everyone can see that?
Yeah, we can see it, Taisa.
Okay. So today we're going to be talking primarily about medical cannabis. As Kelly was saying, I work for RX Files. We're out of the University of Saskatchewan. Now, you might not know what academic detailing means, and basically that means we provide education to healthcare professionals throughout the province. So physicians, nurses, pharmacists, nurse practitioners, we primarily have topics, and we go out twice a year and provide education to them. I'm very happy to be speaking to on a patient level today as well, because we do have some patient information and patient booklets that we create as a part of our learning resources as well. So you can see I've included a picture of our cannabis booklet. on this first slide here. And I'm going to kind of walk through that booklet. And if there is interest in anyone wanting a booklet, we can arrange that with Kelly or Celine, or we'll also share the PDF of it as well and my slides. So a really quick RX Files disclosure. We are a provincial program. We receive funding from Saskatchewan Health to provide that education to prescribers in Saskatchewan. We do have some resources that we create and also distribute to those prescribers. We are a not-for-profit and not-for-loss organization, and I have no funding from pharmaceutical industry, so I'm in no way influenced by any of the big pharma industry. So a quick overview of what we'll cover today, and I'll just watch the time. We're going to go over that RX Files patient booklet, and a few things I'll highlight is types of medical cannabis, go over some myth versus truths in regards to cannabis, some side effects you might experience, and possibly some times where we would consider staying away from using cannabis. Looking at an illness from more than one direction. So, usually there's a multitude of things that we can do to help with an illness, especially pain, to help to get that patient or get you to where you want to be functionally. And then I'll briefly go over what you can expect when starting a cannabis trial. So if you did, with a doctor, decide that you wanted to try cannabis as an option, there are some steps to go through and what to expect from that trial. And then we'll have a Q&A section where you can ask any questions you may have. If I don't have all the answers, I will definitely get back to Kelly and Celine on them, and we can try to answer those for you. So here's our patient booklet again. So cannabis is a plant. The buds or the flower part is the actual part that contains substances called cannabinoids. And that's the part that's going to give that medicinal cannabis. So we believe that when people use cannabis, it's those cannabinoids that cause the effects. In last week's, or a couple weeks ago now, the webinar, they talked about the difference between THC and CBD. So they're the most well understood of all the cannabinoids. However, there's still a lot to learn about them. So THC in general provides that high that we can be familiar with cannabis, where CBD, less of that high is seen and more of the medicinal properties come into play. So if we go over to the right-hand side here, there's a few medical cannabis you may have heard of. So there's prescription cannabinoids, they're in oral form. So there's capsules, there's also sprays and solutions that you get. And so these would be by prescription, and these would be obtained at a pharmacy. There's also cannabis oil orally. So this would be from a licensed producer that we will talk about. There's vaporized cannabis. So the dried cannabis goes into a vaporizer and you're therefore inhaling it. And then there's also smoked cannabis. So although you can get, the dried cannabis and smoke it, usually this isn't the preferred method because of all the side effects that come with smoking as well. There are other products such as creams, teas, cookies, candies, and many more. But in general, the ones we see on the right-hand side here are the ones that are going to be prescribed for medicinal use. So I'm going to have a little bit of interaction with you today, and I've gotten Celine to do some polls up for me. So I'm going to ask a series of 4 questions, and we're going to talk about whether you think they're facts or myths. So our first question is, does cannabis work better than most medications? So do you think that's a fact or a myth? You can take a minute to put your answer in. So do you think cannabis works better than all the other options? Okay, and we can show the results. So myth. All right, and the answer is myth. So for many illnesses, cannabis hasn't been studied, and I know this was touched on in the last webinar as well, that the evidence can be quite limiting when we're looking at cannabis in certain disease states. There is a little bit of evidence for pain, as was pointed out in the last webinar as well. But it's hard to have a lot of confidence in the science that is currently available, and we might see more coming in the future. The other thing that is a downfall to the cannabis trials that are done is they're usually not compared to other medications that may be the standard of care. So the ones we would usually go to first or second line. So it does make sense to try those first or second line therapies first, those standard therapies, before we're going to consider going to cannabis, including those prescription cannabinoids as well. And when we do make a decision to start cannabis, we usually call it a trial with our doctor, under the care of a doctor, just because if it doesn't work for you, or if it's causing you really harmful side effects, then it does make sense to stop it. Okay, our second question. So fact or myth, it's hard to fatally overdose on cannabis. You can put your guess in there. Okay, so kind of split here. So a third of people think it's a myth and 2/3 think it's a fact. So this is actually a fact. It is hard to fatally overdose on cannabis, as there hasn't been any reported overdoses of deaths, but that doesn't mean it's perfectly safe. We do know that there are side effects from cannabis, and I'll go over what a few of those are in a couple slides. Some of them are feeling high, mood changes, memory problems, drowsiness, or numbness. It's really common for patients who start cannabis to get at least one side effect, although sometimes it's manageable and doesn't mean they'll necessarily stop the medication. Even though there are no reported fatal overdoses, it is good to remember that cannabis in excess can cause impairment. So this is really an issue when we think about, say, driving, for example. Okay, our third question. So fact or myth, some types of cannabis don't have side effects. Okay, this was kind of split too. So 2/3 thinks it's a myth and a third think it's a fact. So this is actually a myth. So when we talk about the differences between CBD and THC, it is thought that CBD can be advertised as non-psychoactive or not affecting the brain, but this can be a little bit misleading because some studies have shown that the CBD portion can cause some of that drowsiness or dizziness or mood changes, even though it doesn't give you that feeling of being high. It is good to remember that when smoked, cannabis can cause damage to the lungs, making it harder to breathe. So that's why the smoked cannabis is the less preferred option and can contain toxic chemicals that may cause cancer. There's no such thing as really a safe type of cannabis, but we can make choices that would make it safer to use. It is usually best to make sure we are choosing, maximizing other therapies first, going down those first and maybe second line options, including the prescription cannabinoids. Okay, our fourth and final question. Do you think this is a truth or myth? Cannabis has a low risk of addiction. Oh, this one's really split, almost 50-50. So this is actually a myth. The addiction rate with cannabis in adults is around 1 in 10. If it started even younger, say in a teenager, the rate goes up to 1 in 6 people who may become addicted to cannabis. Even people who use cannabis on the advice of a doctor can become addicted, under no fault of their own. They're following the regimen, but it can have that effect. This is why sometimes we are a little bit reluctant, but we do need to weigh those benefits and harms when we're talking about using cannabis with a patient. Some forms may not be as addictive as others. It's suggested, although it's not very well studied. Again, we don't have a great wealth of studies in this area. So when we are stopping or choosing to stop cannabis, it is good to remember that it can be a little bit uncomfortable, but the best way to do this is to do a slow, gradual taper, especially if you're using quite a bit of it. Then we do want to slowly decrease how much you're using so that it's not very uncomfortable for yourself. Okay, so thank you for participating in those truth or myths. The next thing I want to talk about is some of those harms. So I mentioned we always want to think about, what's going to be the potential benefit of adding medicinal cannabis on versus, what side effects, could I experience. So you can see sedation is quite is high up there on the percentage wise, about half of patients. Now I have a cannabinoids column and then a placebo column. Now placebo just means that it was like a fake drug. So in the trials, they compared the cannabinoids to basically using nothing. They would have just given something that looked like they were using cannabinoids, but it wasn't actually any active drug in there. So you can see on the right-hand side, cannabis can impact the brain, that drowsiness, feeling unhappy, worsening memory changes, or anxiety. Again, smoking has those toxic chemicals, so usually not our first choice if we're going to be ingesting cannabis. So lung disease, chronic cough, increasing the risk of heart attack. Then there's some possible side effects that may surprise you. So I talked about driving impairment, muscle twitching, uncontrollable vomiting, or problems with speech. There are some people who we would avoid using cannabis in just because of the risks that come with it. So if a woman was pregnant or breastfeeding, the cannabis could hurt the baby. Pregnancy and breastfeeding, really, this is an unstudied area for cannabis. If you're under the age of 25, cannabis can hurt the developing brain. And I also mentioned how if you started cannabis as a teenager, you have that increased risk of addiction as well. If someone does have a history of addiction, we do want to avoid it as it can be addictive. Also, if you have a history of a psychiatric disorder or family history of psychosis, this can increase any psychiatric side effects that can come with cannabis. So I mentioned this in the overview, how we do want to treat illness from more than one direction. And This is very important with pain treatment, chronic pain. There's often many ways we can help to help lessen that pain, with a goal of being able to function at a level that is, your goal level. So it is important that medications are usually only one part of treating that illness. So you see, we've kind of used the 4 tires of a car here. So psychological therapy, so things like cognitive behavioral therapy or relaxation, physical therapy and activity can help, self-management. And then the 4th wheel is that medication. So it can be prescription medication. Sometimes it might even mean a trial of cannabis as well. So I do want to explain a little bit about a cannabis trial. So if you spoke with your doctor and this was something that you wanted to initiate a trial with, they would talk to you about those potential benefits versus harms. Ultimately deciding that, this may be an appropriate option for you. So the appropriate trial would include a patient that we feel like may have some benefit. There will be close follow-up and preferably having a treatment agreement, a plan of how we're going to measure the effect of the cannabis, how we may titrate it up for you so that we can measure that functional goals or measure that the decreasing pain that we might see. We also want to pay attention to what suitable dosing or potency issues would be. So I mentioned there's some prescription cannabis products, so the pills or the sprays. They do have some recommended dosing if we're going with other products such as the oils or the vaporized cannabis. There isn't as much guidance on dosing. It's more so just start low and go slow. This was also talked about in the last webinar as well. There's always an emphasis on what the goal we want to set when we're starting a new medication. So especially for chronic pain, emphasis on function and multimodal therapeutic approach. So that just means, all those 4 wheels of the car working together. Again, I've mentioned this a few times, a preference for those non-smoked formulations as they seem to have less of the side effects or long-term toxins. And then we want to always educate around, the possible side effects of impairment or misuse. So causing that feeling of high, the possibility that this medication can cause you to feel like you need it or can become addicted, especially for those formulations high in the THC content, where we need to be more worried about that high feeling. Yeah, and I think that's about 20 minutes, but now we are going to have a Q&A. And like I said, I'll be sharing these slides, and I'll also share the PDF of the patient booklet that I referred to. And if people are interested in having hard copies, we can also arrange that as well.
Excellent. Thanks, Taisa. Is there a PDF that we could share? We usually share slides in an email after the session. Mm-hmm. So we could share a PDF of the booklet or like a printable version or a screen version of the booklet for folks to have a look through.
I can definitely share that. I'll just email it afterwards.
Mm-hmm. Okay, excellent. So I see a question in the chat. We'll maybe start with this one, and then there's a couple of other questions I've got here. And then a few things that I was hoping to ask you as well, Taisa. So the first question came from the chat here. So it's a question around tapering it. And this goes back to your slides on addiction. So are you saying that only 1 in 6 folks need it tapered if that's the addiction rate? Or can you talk a little bit about, stopping cannabis if you decide to stop it and what that looks like?
Yeah, so it's probably going to be very very patient specific, of course, depending on how much cannabis is being used, the type of cannabis that's being used, as well as how long someone has been on it. Likely someone who is possibly addicted, or has the cravings for cannabis, that you may be able to recognize that yourself. In general, those numbers I gave about the addiction rates, I guess those are just general numbers. It's going to be very patient specific, and likely we're going to have to go slow and gradual, and there's no issues, or it's always good to have a plan in place, especially setting those goals temporarily. Maybe you're going to decrease by, depending what you're using, but say 1 pill less a day for the week or 2 weeks, see how that goes, reassess from there. So it's going to be, I don't have a great bottom line answer to that, but it's going to be very patient specific for sure. Yeah, working closely with your provider.
Okay. Everyone's a little bit different, but essentially don't suddenly stop it for anyone. And this is a good question, because, and maybe we could talk a little bit more about it, right? And maybe for folks that haven't heard the term taper before, I'm sure many of us have, but tapering is basically slowly decreasing. So you can tell us a bit more about that. But I'm wondering if you could tell us, because addiction is one thing, but for many folks, they've tried cannabis, maybe it worked, maybe it didn't, maybe they had side effects. For whatever reason, they want to stop taking it. Even if you're not addicted, can you have withdrawal from it? Like, is that part of the reason why you want to taper it? And then, what exactly does tapering it mean?
Yeah, so I believe you can have like withdrawal symptoms from it. Specifically what that would look like, I clinically, I haven't looked into that myself. I don't know if Kelly, you've seen that at all in clinic, but what tapering off means is slowly decreasing. That goes for a lot of medications, especially in the realm of pain medications that we have. Usually it's not a good idea to just stop cold turkey when you're taking a medication. Having a plan in place that we can slowly decrease that from your body, rather than just kind of shocking it, is going to cause you a lot of say those withdrawal effects. Yeah. And just possibly more pain.
Mm-hmm. Yeah, it's really funny, because I think as pharmacists and maybe as healthcare professionals, we're used to reading the information sheets and, it says this might happen and this might happen. And your point about every person being a bit different, right? And, I've had some folks that have stopped cannabis, even on a really small dose, and they just tell me like, Kelly, I just feel a little bit out of sorts, right? Stopped it suddenly, feeling headachy, feeling like just a little bit off, right? And so that's sometimes I think where that taper can be important. But going back to what you said, everyone is a little bit different. Talk to your healthcare provider about what that looks like. It might depend on how long you've been taking it, how much you've been taking it, how you've been using it. So yeah.
Yeah. And it kind of goes back to, we don't have a lot of evidence in this area. So it is good to have that plan in place for yourself. Yeah.
Yeah.
And kind of expect to maybe experience some withdrawal. So perhaps that means, taking a little bit of time off work or something like that. Mm-hmm.
Yeah. And withdrawal is nothing new. Hey, like I stopped coffee for one day. I get a headache.
Many things. Your body becomes dependent. Yeah.
Yeah, exactly.
Tom here. Can I make a comment?
Yeah, absolutely, Tom.
By the way, I can't stop coffee because I don't drink coffee. No, that's true. Anyways, I'm not a promoter of cannabis, but I did take prescribed cannabis oil for my nerve damage. And I was on for 2-3 months and I had no real effect whatsoever. I just couldn't see no benefit to it. So I did stop it. There was no side effects of stopping it when I did. And compared to other medication prescribed by doctors that I had to wean myself off, but I did have side effects from the other meds where I never had any side effects from the cannabis use. So whatever that's worth in the,
Yeah, that was your experience with it.
Yeah, that was my experience with it.
Good. Thanks for sharing, Tom.
Okay.
Okay, a couple more questions are popping into the chat. So this is maybe a good question. There's a specific question about a medication called nortriptyline and if cannabis can be used with that medication. And I think maybe for today's webinar, we might not get into some of the details. So Carol, I saw your question and we can maybe, Taisa can answer that specific question for you maybe offline, but let's talk really generally about drug interactions, Taisa. Can we expect drug interactions with cannabis and other medications, particularly what we use for pain?
Yeah, so yes, likely. Again, with cannabis, we just don't really know. The way they work and the way they're working on receptors, we don't have as great of an idea with studied prescription meds that we have. We know kind of how they work in the body. Cannabis is still kind of unknown how they're exactly working in the body. Things that we would watch out for is, say, if you were on another medication that causes drowsiness and we're adding in cannabis, that's going to be, additive effects, so might increase drowsiness. I'm just going to check here if we have anything additionally with drug interactions, but yeah, and I can take a deeper look. Basically, not fully understood, and many are theoretical is kind of what not great evidence for it, but we do have to watch for those extra side effects. Mm-hmm.
Yeah, this is one that comes up a lot too, just in working with folks that live with pain and pharmacists. Hey, we always talk about drug interactions, and your point about those like combined side effects. So something like nortriptyline that might cause drowsiness. Then you add another medicine that causes drowsiness, and that becomes additive, right? And we can't always predict what that looks like. So dizziness is another one that I see common overlap, right? With cannabis and with medications that cause dizziness, that can overlap. And, some of what I've looked into, there's also ways that our bodies process meds that lead to drug interactions. Like we rely on our liver and different parts in our body to help process medications. And cannabis can affect how your body processes other medications. And that's where someone like Taisa or I would really have to sit down with your medication list and look at, okay, what are you on? And are some of these processing drug interactions something to be mindful of, right? And sometimes it's just a matter of monitoring them, okay, here's what we might expect. And like Taisa says, there's lots of question marks here, but as a pharmacist, I know we have some prescription versions of cannabis products. Like there's actually cannabis products that are prescriptions. And so we can use those because we know lots about drug interactions there. So sometimes I kind of cheat and I look at, okay, here's the prescription products that we've got. Here's some of the drug interactions that happen. We might expect this from someone who's using a cannabis product. So yeah.
Yeah. Yeah, those, the oral pills, the Nabalone and the spray, I guess, kind of have the best evidence that we can get. So we try to compare to that.
Yeah,
I see. So I had my students join in this conversation and I see they asked very in-depth questions that are very pharmacy related. So I can answer them separately.
Yeah. Some questions just about addiction rates and these are very pharmacisty questions.
Yeah.
Maybe we can tackle those if we have some time after.
Yeah.
I wanted to touch on a couple of other things that have been messaged to me here privately, or just something that came up in last week's webinar that I wanted to but go to next. Taisa, can you give us some tips or what does access look like? Like if someone is interested in trying a cannabis product, I know you said talking to your doctor or healthcare professional, but can you tell us a little bit about like how do we start this? What does access look like?
Sure. And I created a slide because Kelly gave me the heads up on this. So I am going to share it. It's a little bit easier to follow in a slide. So there are some steps we have to go through with getting cannabis from a licensed producer for medical cannabis. So if you're talking to your prescriber, they would complete a medical document, and basically it's just your information and how much they're authorizing. They don't actually authorize a specific product, like they don't say oil or dried or the other options. I should mention this is for the non-prescription ones. So then not the pill and not the spray I was referring to. So this is either the dried oil, buds, or leaves. So number one, your physician will fill out that medical document. You can then take it yourself to a licensed producer, or they can fax it to one of the licensed producers. We also recommend having a treatment agreement with the doctor, just so that everyone is on the page as well. So as you can see, I've included the link number 3, which is a list of those licensed producers. And then they will mail the cannabis to you, and they talk with you about what you would like for that licensed product. So it can come as the form of an oil, dried, buds, or leaves, as I mentioned. Or if you would like to grow your own, there is a limit on how much you can grow as well. And this medical document that you fill out, so link number 1, has to be renewed, reauthorized once per year. In Saskatchewan, the prescribers will keep a list of all of their medical cannabis patients, and there is no set daily limit. But the max possession is the lesser of 150 grams or 30 times the daily amount. So when the physician is filling out the form, and they would be familiar with this, but they don't say that X amount of grams per day. They basically just authorize it, I believe, per month. I just have to check the form. I also included a link, Cannabis for Medical Purposes. Health Canada has a link that actually has nice information for obtaining medical cannabis and kind of the steps that you can go through. So that could be useful as well. Yeah. Kelly, do you have anything to add to that at all?
Yeah, this is always an interesting question for me to tackle when I'm talking to folks about cannabis, because this is the medical stream, right? Obviously, there's now recreational supply stores. So we can all walk into a local store. You know, we have Prairie Records here in Saskatoon, and those are, recreational stores. This is the medical process, right, where you get the authorization through your physician. And, I started doing this back in, when cannabis first went legal recreationally. And my experience with it then was I was often linking folks with some of the licensed producers. So these are people like Aurora or Canamed or Tilray or Spectrum. So these are the folks that, are obviously making cannabis. So you have to always be cautious, right? Because this means someone that's selling a product is also giving you advice on that product. And there can be some risks there. But my experience has been that they often employ some, I know some pharmacists that work for some of them. They employ healthcare professionals, and it's a nice liaison. So I always suggest to folks, your doctor, your healthcare provider, your nurse practitioner, your pharmacist, work through the process so that all of your healthcare providers know that you're taking cannabis. These licensed producers can help you with some information and getting links to things like this medical paperwork and picking a product, right? Because there was a time when, even as a pharmacist, I was asking some of these suppliers, like, what products do we have available? What are the options that, out there? Mm-hmm. And so they were really good sources of information. Last week, we talked about another provider called National Access Cannabis. So there's several that are out there. Certainly I don't endorse one over the other, and that caveat that ultimately they're still selling a product. So it's important to kind of involve them, involve your healthcare provider, and then move forward, right? So, yeah.
Yeah, that's a good point, Kelly. It is nice to go with a licensed producer because they do have usually someone who's going to speak to you about, here's the options, this is what maybe your starting dose, we'll go slowly, we'll titrate it so they can come up with a plan with you, versus just walking into a store that's now legal and just buying a product off the shelf. I don't think you're going to get that. I don't want to say this, that I'm just assuming, but I don't think they employ healthcare professionals in those stores. So going the licensed producer route, you at least have someone to speak to that can provide you with, a little bit of evidence base or have that medical background to be able to find that dose that will work for you, and also the dosage form that will work for you.
Yeah, good point, Taisa. The people at these stores are not trained medical professionals and aren't even like trained for medical use of cannabis, right? They're trained for recreational use, which is a different ball game. So those bud tenders aren't necessarily the experts in medical use of cannabis. Great point, Taisa. Okay, I know we have an activity to get to. I did want to ask you a question about topicals. I have lots of folks asking me about, CBD cream and rubbing CBD cream. I heard some Hollywood starlet talking about how she put CBD on her feet before the Oscars.
Yeah,
she was wearing high heels.
You also gave me a heads up on this question. So I summarized what I could find in terms of topical cannabis. So as I mentioned, when we're talking about getting that prescription with our doctor and doing that medical document, that actually doesn't include topical cannabis in there. So those forms I was speaking about were all orally ingested. So when we look at topical cannabis, it would be intended for that localized effect. So if you had a sore knee, then you would use it on the knee. So it's a very localized effect, thought to be. It's not well studied, probably the least out of all of the dosage forms, and hasn't been proven to work. There's a lot of issues with the trials. In the last webinar, they talked about some of those issues where there's a lot of, the patients know they're taking it. So could it just be the fact of placebo, or it's not? Yeah, there's a lot of factors at play when it goes into the evidence, but basically the bottom line is it hasn't really been proven to work. Possibly some of the other ingredients in there are helping. So there'll be, say, menthol in with the topical mixture, and that could be helping with your pain. So we don't know if it's those other ingredients or actually the cannabis helping. Side effects, they're understudied again. However, when we use something topically, we think unlikely to cause serious harm. We might have some issues with rash or itching on the skin where we used it. We also want to be worried about those unregulated sources having contaminants or uncertain potency. So if you're not getting it from a licensed producer, and we'll talk about a little bit about regulated sources as well, I think, following this, Kelly, but say if you were just buying it off a website, off the internet, and didn't know if it was actually had approval, we could be worried about contaminants. And overall, these topical cannabis products, they're not considered a therapeutic product like the other medical cannabis products. So the oral ones are considered to be under that medical cannabis umbrella, whereas the topical ones are not. They are regulated under the Canada Act, so they do need to label the THC and CBD content, and they're not allowed to make any health claims on their labeling. So if you see something that's claiming like outrageous health claims, that's technically not a regulated product.
Good to know. Okay, so not a lot of evidence. Watch out, because they aren't regulated in the same way. And, I get a lot of folks asking me about hemp hay and the hemp lotion. And I think that's really important, is hemp is not the same thing as cannabis, right? By definition, hemp has less than 0.3% of active cannabinoids, active THC. So, great for fatty acids, but not so great if you actually want that medical product, the medical cannabinoids, right? The CBD and that. Yeah. Okay. Taisa, we have lots more to talk about, but we're running out of time. And I know Selena's already probably looking at her clock. We have a video for our next segment. So I'm going to move on to that, but certainly if there are other questions, we can possibly answer them in an email or connect with people individually or one-on-one. So Taisa, thank you so much today, or for sharing all that great information with us today. I'm looking forward to getting a copy of the RX Files brochure. And like I said, thanks for joining us today.
Yeah, thank you for having me.
Yeah, we are going to move on to our activity. So we have a recorded session. Dayna's back for art therapy. So Dayna Fesciuc is a 48-year-old artist, writer, and photographer who's been using art therapy as a way to manage her chronic pain. Dayna says art therapy has made a measurable difference in her pain and has been a game changer with helping her get back to living her life. I'm really looking forward to today's art therapy session with Dayna. So I will get Celine to roll that video.
Hey everybody, so we're back for art therapy, and we're doing something different because Easter's coming up, and I love Easter. I love chocolate, so basically anything to do with Easter and chocolate is a good thing for me. But today we are pulling out all the stops with regard to a colorful, bright, fun, and hopefully something special to give to someone. And so I hope you guys really like it. We are making, it sounds simple, but it does have a lot of parts to it. So we are making a Easter card, and I will show you everything to do with it. So let's get started. I'll start holding up our supplies. So that what I held up to you there is, hold on. Okay, so I dropped it. That's why I had to say, hold on. So here is our Easter card to start. Now what we're using is basic Bristol board paper, which is basically those big white sheets of craft paper that you see at any store. We're using that. I cut it down to a size that I wanted to work with. I folded it in half to have it be extra strong, so it would in fact stay sitting up and hold its form. And then I taped it off to be able to see the size that I wanted. So all of that depends on what you're looking for. If you want a really big card, if you want a smaller thing to work with, then that would be decided upon of how you want to go about it. And that would be all decision making before you get into doing anything with it, color saturation or anything like that. So this is the first step. Second step is choosing what you're going to use on it. So today I'm introducing you guys to oil pastels. If you've never worked with them before, it's okay. I will show you different types that you can use. We're going to use extremely basic. These are kids ones. These are Crayola oil pastels. Okay, and it literally is a kids pack that you can get again at any store, so it's easy to use and it's easy to find. It's a 16 pack, but you guys can get whatever size pack you want to be able to start with. And then the other things I'm using are the things that you've seen me use before, which is the Posca markers, all in Easter colors, and I'll probably use my my particular pencil to sketch with. But having said that, you guys can use whatever you want, whatever you feel comfortable with like that. And then we might use a glue stick, so you might want that on hand. Have some scissors or an X-Acto knife so that you can cut whatever you need to cut for your project. And that's, I think, about it. Oh, and of course your painter's tape. All right, let's get going. So you've seen that I folded that and I made that into a actual already set up card. So now I'm going to take you through the exact steps that I did for that again, and then we'll start laying in color. Okay, so here's a piece, you guys, that I cut down again, another one, just so that you guys can see. This I folded as like an accordion. So basically, I cut a piece, I folded it in half once and then in half again. You could stand this one either this way as like a tent card, or you could stand it this way, either way. You can see that there is the space in between, and like the folds are obvious, but if you wanted to take those out and make it even more cleaned up, you just basically, when you get to this stage and this stage, you just use your glue stick in here to be able to do completely cover it and then stick it to itself. And then the same thing in this part, this section. So I guess this stage would be the best. Start there, put this all covered in glue, and then fold this over. And then once it's dried or starting to dry, then you can fold it again and crease it so that you've got the card size that you want. So that's one card size. You can see it'll be that size or a tent one. And then I'll show you again the one that I'm working with. So mine, I'm not worried about my edges or that separation yet. I might do that at the end for me. You can do it at the beginning or the end, whatever floats your boat. And mine is a slightly larger card because I have a design in mind. And so then I taped it off on the edges here so that my design is in the middle and it'll have a white border going around it just for an added pop. So I may or may not keep that white border. I may do something decorative in it at the end, maybe use Easter washi tape or something going around. I don't know yet. I'm just at this stage with you guys so far. So that's the card so far. And now I'm going to get the pastels and show you how they work. You guys, we're doing this part in parts as well. So I've got now, I'm using 3 Crayola oil pastels. I'm starting with the yellow. I want 3 grades of color going on here. So what I'm going to do is these basically, they go on like a crayon. okay? And the thicker you go, the brighter it is, the more substance it has as you go. If you go really light, you can get that type of effect too. But you can also go heavier to get a brighter swatch, and then you can get it to be lighter by doing this technique that I'm going to do, which is a rubbing technique. So basically, I put that on, and now I'm going to take a paper towel. I'm going to fold it up. I've got some color already on there because I tested this out beforehand. I try to always do that for you guys. And I knew it would work, but I wanted to make sure. So now, take paper towel, just as like a pack of paper towels. 3 I've got over top of each other to form a pad. And then I'm just going to rub back and forth over this. What it does is it fills in any gaps that were white, and it takes it down so that it's nice and soft looking on the page. Okay? It creates this nice soft edge. So you might want to do that just to practice for yourselves. You can have it either the rough kind of look that a crayon actually looks like, because that's how it started, or you can get it to look like this to start. And then I'm going to take my next color. So my next color for me is pink. You got to be careful. You go right to it, but not on it. The reason why is because pink and yellow together makes orange. If you do not want orange on your card, then you want to make sure that it doesn't really overlap. When I get to the bottom, it's going to be purple for mine, but you guys might not want that. You might want it a different color, whatever. Just practice on a card ahead of time so that you know if they do overlap, what does that make? Because like yellow and purple together, for instance, makes brown. So if you don't want brown, don't mix your colors. Now I've got this, I'm going to do it again a little bit brighter so it goes that fade out that I want. And then I'm just going to take it very carefully and do what I did before with the yellow, but now with the pink. And I'm going to rub it back and forth. And I'm going to fill it in and get it to be that really soft kind of color. I got my pink on there. My next one is purple. So I'm going to do the exact same thing and just layer that on here. So purple and pink together just make a different shade of purple. So if you're worried about that one together, you're okay, because it's just a different shade of purple. So okay, so as we go here, I'm going to take that and see what it looks like when I blend it, or when I go over it with the pad. It's getting to be a very faint purple, which is exactly what I wanted, kind of like a pastel. I too, though, again, don't want the white to show. So anywhere where there's white, I'm just going to go back over top with the oil pastel. See, this is something that you cannot do with crayon. You can try, but it doesn't work as well. But the oil pastel can give you these added functions that a crayon cannot. And I can tell you that I use high-end products when I'm doing commission work or anything like that. But when I'm doing something like this, I use my like junior products basically, and they work just as well as my high-end ones. The clarity of the high-end ones has a little bit more to it, and it has a little bit more staying power, but that's all the only difference. So now I've got a gradation here of, or what I wanted on here, which is the yellow, pink, and purple, and I'm going to go from here. I'm going to sketch on my character next, and I'll pop back on. Hey guys, okay, so I'm back for half a second here, so or a little bit here. I wanted to show you that I did the bunny, but I had a problem with my bunny in that I tried to use my Posca paint marker, which does work over this, but this guy is dead. So I ended up having to go in with craft paint, which I was not expecting to do today, but I used that regular craft paint that I use always when I'm showing you guys this, and it's just an acrylic craft paint, and it worked just as well to fill in my bunny. So I sketched him out, I filled him in. I'm going to do the details on him pretty quick here, and then I've got some words that are going above him, and then I also went ahead and I did the inside, a part of the inside of the card. So I sketched in my grass. I sketched in a basket with some eggs in it. And I've got another part of the bunny here. And then I've got words that will go there as well. So that's the next stage that I'm going to show you. But I wanted to show you that this is what you can do with the oil pastels. Acrylic can go over this, even though acrylic is water-based and you're working with oil pastels. They do actually surprisingly work well together, which is kind of shocking really, but they do work well together. You just have to make sure that they dry. So right now I'm waiting for my bunny to dry there and the inside bunny to dry. And then once that's done, I'm going to come back and show you the detail work that I will do and that I did do on it. And then we'll get our words popped in and then I'll show you what I'm going to do with the edge. Okay, so I'll be right back. Guys, I'm back. So what I did was I outlined my bunny inside, and I've not outlined the basket yet, but I probably will just to make it pop. And the little Easter eggs that I've got in there, I used a deeper green of grass in the basket, and I used a bright green for the grass there. So I'll probably go over that with you guys here and maybe pop the grass a bit more with darker little lines in it as other grass. And then on the outside here, I've drawn my bunny and I've outlined him, and he's so cute. And I've gone back and I used this oil pastel just in his ears and to pink up his cheeks and give him a little pink nose. And then I used the black Posca marker, which is always my outliner, to go around him. And now I'm just writing in the words. So what I wanted to write, because I just thought it was a funny card, is some, and you're probably going to guess it, some bunny. I'll do a fancy L or a regular. I'll do a fancy L. Loves you. There we go. So there's the front of the card. Somebody loves you. It's just a cute little card. And then inside, I'm going to go ahead probably right now and do the black, which is the outlining of the basket. I used a thicker marker for him, or the thicker paint marker for him. And I think I'll probably use the thicker for the basket, but maybe a thinner one to do the lines inside of the eggs. So I'll do that with you guys now. So basically, you guys, the whole point of this is, yes, it's a simple card. Yes, it's kind of, some people might think, oh, that's so silly. Why would an adult want to sit there and make that? Well, lots of reasons why. If I, for instance, give this to my sister for Easter, she will know I handmade, hand-painted, and took time and energy and love and put it into a project that then I give to her. It has meaning. That has value and meaning. And it also has value and meaning that I've dodged my pain for the entire time that I've been working on this. And I've given myself set rules to follow. But at the same time, when something went wrong, I changed it up. It's totally forgiving. If you don't like the card when you're done, well, like I've said before, either cut it up and use it in a different way for a different art, or like a collage or something, and then just take another piece of paper, start another card. I mean, I was going to say one that say, hey, you're looking pretty spring chicken, and put a little chicken on. I mean, it might not be the best phrasing, but you know what I mean. Just something as like a fun thing. So yeah, I'm thinking I might give this actually to my sister for Easter. And it just might be something then special that I've got. I don't get a chance to go out very often. I could order cards, I guess, from someplace, but I prefer to hand make when I can. And again, like I said, you could do this if you wanted. You could do it with kids. Obviously, it's a simple thing. If you wanted to do it on your own, clearly you can. It's a super simple project to do. But again, for the time frame that it's taken me to work on this, I have not been dealing with my pain. I have been working through everything that I've got going on physically by centering my mind on a task, an easy, simple task, but a task nonetheless that means something to me. It gives me that chance to really focus away from my pain, away from what my body's going through on a constant basis. And that break is not just a body break, it's a mind break. When you can take your mind off your pain for any length of time, I'm telling you, you guys, it's so worth it. It's so, so worth it. So now all I've done is I've just gone around those, and I actually, if I'm careful, I can outline with this. So I'm going to do that, outline the eggs with the black. Don't really like using black for Easter, but as an outline, it's okay. And once I've got that all outlined, then all I've got to do left to my mind is to do something inside here. So I'm just going to do probably just Happy Easter, and I'm going to do it in the same bright pink. Now the things that I will still fix with this, I will go back, and after I take my tape off now, I'm going to probably glue it together so it is stable together like that. I'm going to wait until it completely dries, and I'm thinking about what to do for this outside edge. I might just strip it back right now, see what it looks like. Oh, see, that's really pretty. Just taking those lines off, that works really well to be able to do it that way. And then you've got that like white kind of border around it. It's really pretty. That you've got some cards you can get like that out at stores anyway. So yeah, I think this is a great project. It's a great way to just relax and have fun. And like I said, this is something then that is personal rather, that I can give to her. Anyway, so that's what I wanted to make with you guys today. I wanted to make sure that it was simple. And again, I was trying to have it be where most of the supplies that I use are ones that you either already do have at home, in either just straight markers that you could use. You could use crayons to do this, literally crayons. It won't rub off like the old pastel does. And you could use pencil crayons to do it. You could use markers to do it. When you double up this, it doesn't bleed through. Okay, so that you could use markers to do it if you wanted. And like I said, it's personable, it's fun, it's cute, and it took me away from my pain. And the best thing of all, addedly, is that I was able to spend that time with you guys. I hope you like this. I'm going to go back now and just glue this in. And then I'm going to call it a day in my studio and go rest my legs. So, thanks for being here with me, you guys. Hope you like this one. Bye.
Oh, once again, Dayna delivers with her art therapy. And I'm not sure about you folks, but I was taken back to my childhood and the smell when she said oil pastels. Could anyone else smell the oil pastel? All right, I'm so sorry we've gone over time again. I think all of my sessions tend to go over a little bit, but we'll wrap up right now. Thanks to everyone for hanging in. Once again, a big thank you to Taisa Trischuk and Dayna Fesciuc for sharing their time with us today. And thank you to each and every one of you for being here. Few housekeeping reminders: recordings of the webinars will be available on the Saskatchewan website. The link to these will be shared with you by email. You'll also receive in that email any slides or handouts that our speakers will be sharing, and a link to the evaluation. So please be sure to complete the evaluation and provide us with your feedback. Also, to let you know, the webinar schedule and topics for sessions in May and June will be released shortly, so please watch your email for details. I've seen the sneak peek and they are amazing. I'm really excited about what's to come. Our next webinar is scheduled for Wednesday, April 27th at 2 o'clock in the afternoon. Our theme for the webinar is mindfulness, and we'll have Dr. Anita Chakravarty speaking to her experience as a healthcare professional, a person living with pain, and she's got always amazing tips and activities. Please share information about this webinar with your family and friends and social circles. Once again, a big thanks to each and every one of you. Happy Easter this weekend to everyone celebrating. Please stay safe. I'm not sure that the weather is going to cooperate with us, so I hope that wherever the weekend takes you, that you are safe and warm. All right. Thanks again, everyone. Take care.